Right now, nearly 1 in 8 people globally is living with a mental health disorder. That's almost a billion people. A billion people navigating conditions that, honestly, society at large still fundamentally misunderstands. So welcome to this explainer. Today, we're going to completely unpack the complex medical reality of mental health. We're diving deep into the hard science, the specific brain chemistry, and the clinical evidence that proves these are physiological realities, not character flaws. Our goal here, to replace societal stigma with rigorous science and to swap out silent judgment for clinical empathy. Let's get into it.
So what exactly is mental health? For generations, society treated mental health struggles as a sign of personal weakness, like someone just wasn't trying hard enough to be happy. But modern medicine tells a radically different story. Mental health is a deeply rooted, absolutely critical component of our human biology. Think of your brain like the most sophisticated computer on the planet. Just like your laptop's physical hardware can get damaged, or its operating system can run into software glitches that crash the whole thing, your brain can experience real biological and functional illness. It's vulnerable, it's incredibly complex, and it's inextricably linked to your overall survival. In fact, the World Health Organization defines mental health not just as the absence of a psychiatric illness, but as a holistic state of emotional, psychological, and social well-being. It literally dictates how we process complex thoughts, how we behave in crises, and how we handle the relentless stress of everyday life. And this specific definition is a real game changer. It fundamentally shifted global healthcare policies, forcing governments and medical boards to recognize that cultivating a healthy mind is just as vital and just as medically legitimate as keeping your heart healthy or having a strong immune system. So here's our roadmap for today. We'll start with the reality of mental health, then look at the biology of the brain, and move into understanding the disorders. After that, we'll cover modern medical treatments, real paths to recovery, and finally, breaking stigma and finding hope.
All right, let's jump right into part 1, the reality of mental health. Humanity has been on a long and honestly pretty dark journey from fear and superstition to scientific enlightenment. Back in ancient times, severe mental illnesses were terribly misunderstood, usually chalked up to spiritual failings or myths, which led to some truly tragic outcomes. The 19th century finally began to shift this with the evolution of clinical psychiatry, though treatments were still pretty rudimentary and mostly just confined patients to asylums. But the 20th century? That sparked a massive revolution. The discovery of psychiatric medications and formalized psychotherapy meant millions could finally leave institutions and go back to their families. And today, in the 21st century, advanced neuroscience and fMRI brain imaging let us literally see these illnesses in real time. We've moved from guessing in the dark to treating observable physiological evidence.
Which brings us to section 2, the actual biology of the brain.
Now, what's really interesting here is how the physical hardware of the brain works. Imagine encountering a sudden, terrifying threat, like coming face to face with a wild animal. Instantly, your amygdala fires off a massive fear response to keep you alive, while your prefrontal cortex is desperately trying to logically assess the situation and plan an escape route. At the exact same time, your hypothalamus is flooding your system with stress hormones, your hippocampus is recording the memory so you know how to survive next time, and your basal ganglia is driving your physical motivation to just run. Every single second, these intricate regions are mapping our emotional and mental lives. So when a mental health disorder occurs, it's actually an observable, physical disruption in how these specific areas function, misfire, or fail to communicate with one another under pressure.
And driving all of that crucial communication are specific chemicals: serotonin, dopamine, norepinephrine, and GABA. Think of these neurotransmitters a lot like your brain's internal Wi-Fi network. If the router is broken or the signal is weak, the system glitches, data gets lost, and the machine just stops working right. An imbalance in these chemical messengers, whether that's triggered by genetics, severe trauma, or just chronic, unrelenting stress, directly contributes to psychiatric disorders. This is exactly why you can't just tell someone to snap out of it or cheer up. You wouldn't try to just will a broken Wi-Fi signal to reconnect without fixing the router, right?
Okay, let's move on to section 3, understanding the disorders.
Mental illness is definitely not a monolith. It's a vastly complex spectrum that requires highly specialized care. Medical professionals actually categorize these biological imbalances into distinct treatable conditions. For example, mood disorders fundamentally alter a person's baseline emotional state. Anxiety disorders, which range from generalized anxiety to severe PTSD, keep the brain's threat detection system locked in overdrive. Psychotic disorders disrupt a person's fundamental connection with shared reality, while neurodevelopmental conditions influence how the brain grows and processes information from early childhood. Seeing it all laid out like this really proves that diagnosing mental health is a highly organized, heavily researched medical discipline that requires immense clinical precision.
To really build empathy for what patients actually endure, we need to look closely at the visceral reality of these distinct diagnoses. Take major depressive disorder. It isn't just feeling a bit sad. It brings a crushing gravity, overwhelming fatigue, and a severe loss of interest in living that makes just getting out of bed feel physically impossible. Now, contrast that with bipolar disorder. A patient might experience those exact same crushing lows, but then violently swing into the dangerous, high-velocity friction of mania. During a manic episode, the brain races uncontrollably, sleep basically vanishes, and impulsive, high-risk behaviors take over. These are completely different biological storms, which means they require entirely different medical interventions.
I want to speak directly to you for a second, because you really need to memorize these signs. You might one day be the absolute first responder for a friend, a coworker, or a family member in a crisis. Just like a sudden heart attack, mental health emergencies are incredibly serious and potentially fatal. Active suicidal or homicidal thoughts, a sudden break from reality in the form of severe psychosis, or an abrupt inability to feed or care for oneself. These are not moments to wait and see. They require immediate, urgent, emergency medical intervention. Prioritizing safety and getting a professional involved right away is quite literally how you save a life.
Moving right along to Section 4, Modern Medical Treatments.
The mental health ecosystem can honestly be super confusing to navigate, so let's clear up who actually does what. A psychologist is an expert in the mind's software. They specialize in psychotherapy, rewiring negative behavioral patterns, and deep counseling. On the flip side, a psychiatrist is a medical doctor who focuses on the physical hardware. They diagnose physiological conditions and prescribe psychiatric medications to balance brain chemistry. Very often, the highest success rates in modern medicine come from a dual approach, where both of these professionals work in tandem to treat the patient's mind and brain simultaneously.
Now, entering treatment is rarely a straight line. It's an individualized process, definitely not a one-size-fits-all conveyor belt. It usually begins with a comprehensive medical assessment just to rule out physical mimics, like thyroid disorders. Then, it frequently moves to targeted psychotherapy, like cognitive behavioral therapy. Depending on the severity, psychiatric medications might be introduced to help stabilize those neurotransmitters we talked about earlier. And finally, lifestyle management is integrated for long-term health. But it's so vital to know that patients often loop back through these steps. Adjusting medications or changing therapy styles is just a totally normal part of the trial-and-error nature of psychiatric treatment. Healing takes time, and it takes immense patience.
Which brings us to Section 5, Real Paths to Recovery. Let's ground all this medical data in reality. Consider the transformation of a young professional whose major depressive disorder had become so paralyzing that their career and personal relationships were completely collapsing. They felt entirely hopeless. But by entering treatment and combining cognitive behavioral therapy to actively dismantle their toxic, self-defeating thought loops, alongside carefully managed antidepressants to give their brain the chemical scaffolding it needed to heal, they steadily regained their life. This isn't just clinical data on a chart. This is the biopsychosocial model pulling someone out of the dark and handing them their future back.
And remember, recovery is incredibly individualized. Take, for instance, a college student whose severe panic disorder made just stepping into a crowded lecture hall utterly terrifying. In their specific case, recovery didn't even require long-term medication. Instead, it was achieved through highly targeted psychotherapy and specialized physiological anxiety management techniques. By learning to control their breathing and reprocess the physical triggers of panic, this student fully reclaimed their academic and social life. It just proves that evidence-based treatment adapts to the unique needs of the individual's brain and circumstances.
And finally, Section 6, Breaking Stigma, Finding Hope.
Here's the absolute truth. The most advanced medical treatments in the world are completely useless if people are too deeply ashamed or terrified to actually seek them out. And this is exactly where you come in. Long-term recovery relies on society building an environment of empathy. It requires us to actively debunk toxic myths, champion inclusion in our own workplaces, support mental health education in our local schools, and speak openly, without whispering, about suicide prevention. Eradicating stigma clears the runway for people to finally step forward and say, "I need help." You have the power to be the empathy that completely changes the trajectory of someone's life.
Let me leave you with this thought. Mental health disorders are common, real, and treatable medical conditions. Seeking help is a sign of strength, and recovery is possible. Today, we've explored the hard neuroscience, the clinical classifications, and the deeply human paths to healing. The science has unequivocally shown us the way forward, finally lifting the veil on conditions that were once shrouded in fear.
But as we wrap up this explainer, the most important question still remains. How will you use this profound understanding to change the conversation around mental health in your own community?